Hi guys, my name is KP Balan. Some of you guys know me as a clinical tutor, but I'm also a resident medical officer here in Perth. So last time we talked about a clinical examination prep part 1. And today we're going to talk about part 2 of how to approach the clinical exams. So let's get started. So first and foremost, practice, practice, practice. There's no substitution for practice. So when I say practice, what I mean is, from my personal experience, I practice about 6 to 8 hours per day. Now, I know that's not possible for a lot of you out there because you have kids, you have jobs, you have a lot of things happening in your life, and I understand that. But however, exam is an important thing, so at least practice about 4 hours per day. Split it if you have to. 2 hours in the morning, 2 hours at night. And when you do this, make sure it's a time that suits your partner if you do have one, and that you can concentrate the best during that time. Now, in between, what you could do is go over recalls, go over topics that you're unsure of, go over guidelines that you're not sure of, and brush up on things that you would like to just read and just skim over. So this is a good way to prepare for the exam as well. Now, recalls. How long of recall should I do? Personally, I would advise, if you have the time and place, do 1 year's worth of recalls. But again, those of you who have booked your exams, don't panic. If there's not much time, do 6 months worth of recalls. And I would also suggest, those of you who have your exams soon or when you're about close to your exams, do at least 2 months worth of recalls and make sure you're well versed with those recalls. What I did was I made a frequency list of the last 6 months recall with my husband, and I practiced the most frequent ones, the rare ones, and the ones I was not sure of just 2 months prior to the exam. That really did help me a lot. And in terms of recalls, I like to touch base with the physical examination recalls. Now, there are 8 stations that you cannot miss in the exam. One is the 4 stations for your PE exam, so that's 4 stations right there, 2 handbook cases, and 2 of your counseling stations. You can't miss those. You can't afford to miss those. So physical examination. When you're close to your exam, about 2 months, a month to 2 months, practice at least 4 clinical stations at night before you go to bed. This is not because I'm telling you that you don't know how to do the physical examination. It's not because of that. They take a lot of time, they take a lot of effort, and you have to do them fast. All right? And also, they need to have a very organized approach. From my personal experience, I can tell you, if you do it in an organized approach, the examiner does tell you to skip certain examinations. That takes a load off, and you can also finish the examination in time. So again, guys, if you have a clinical tutor, ask them what's a good approach to start with. And those of you who don't, that's all right. Create one. All right? And apart from that, now, when you do practice these recalls, I cannot stress how important it is to make at least 10 differential diagnoses for each cluster. It is very important because in the exam, you're panicking, you're nervous, you don't have that much time. Time goes by a lot faster. So if you practice with 10 differential diagnoses for each cluster, when you're in the exam, it'll be much easier for you to come up with at least 4 to 5. And nowadays, if you notice in the exam, they don't ask you for management much in most stations. You have 1 or 2 stations with management. The rest are give probable diagnosis and differential diagnosis. Now, apart from this, when you practice these differentials, how do I organize them? How do I make them out? I have 2 suggestions. One is you could do head to toe. That's one way to go about it. My personal favorite is, not to rule out any of the important ones, is to first and foremost involve the ones that are quite drastic and deadly and cannot be missed, or things that can be reversed and is life-threatening to the patient. For example, such as meningitis, stroke, acute MI, PE, spontaneous pneumothorax, things like that. And then I go to the most common condition, and then I go to rare conditions, and then psychiatry conditions. So this is one way to chart out your differential diagnosis, and make notes, write post-its, or write it in your notes itself. This is the list of differentials for this cluster. Write it somewhere so you refresh your memory each time when you look at it. And apart from that, make sure you practice at least 2 or 3 subjects and keep shuffling them around. Now, if you have any questions, please do leave your comments below and stay tuned for more videos. See you later.